For us as WaterAid, we are looking at creating a health environment where young people can access quality healthcare. If you look at 60 million people across the globe, of which Ghana is a part, you would notice that there's the need for intervention. In some places, they will tell you that when you're a young person, you cannot go in for family planning services. Our bigger goal that we are focusing on is to reduce teenage pregnancy. We would want to even scrap teenage pregnancy away from the region.
Welcome back to Let's Share. I'm your host, Molly Dasobri. Today, we'll continue the conversation with Gilbert Ashanti, who is the project lead for Share and the program manager for WaterAid Ghana's Wash and Health Aid. Let's get started. So Gilbert, the conversation has been interesting. You've said a lot. And with every intervention you have done, the training with the health workers, I can imagine how hectic it has been because you have to change their behavior, change to a lot of things. How is WaterAid or how is Share planning to sustain these interventions so that after the 5 year, even when Share leaves or WaterAid stop working in these districts, how do you plan on sustaining that the community or the people would practice the good work you have already preached?
Great, thank you very much. So with sustainability, we know it's a problem. Sustainability is a problem within our country, and we are trying hard as a country to make sure that we sustain most of the interventions, government interventions, other interventions that have been put in place by our development partners, and so on. So on this project, what we are focusing on is using the life cycle costing approach to train this is assemblies to train the Ghana Health Service staff for them to understand the full cost on every project that they are putting in place, and then the maintenance cost that they need to put in place, the operation cost that they need to put in place. I mean, if you put a borehole in a facility, or you put a youth corner in a facility, or a youth center in a facility, and you don't have plans to maintain that facility, it will get to a point where that facility will deteriorate, and services cannot be rendered within those facilities. And so for us, we have started engaging the assembly, Ghana Health Service, the traditional authorities, and all the stakeholders on the project to discuss with them, how do we sustain this beyond the project? How do the gains that we are getting from this project, we keep it beyond the project? And for me, when it comes to...
So I feel like what you are doing is making sure that these partners have an ownership
exactly
of whatever intervention you are doing for them. So that is the feel you want them to have. So that when you leave, they feel like this is mine and we are responsible for it.
Exactly.
If I'm getting you right.
Exactly. So for instance, when it comes to the capacity building, we're using people within the districts, within the region. And so the knowledge sits with them. And so in absence of WaterAid, they are still there to build the capacity. And we have seen places where the people we have built capacity over the years are also retraining other people in different areas within even the region. And so for me, those are some of the things that we are putting in place to ensure that we sustain the project beyond the 5 years. Else, 5 years comes, we pack our bag and baggages, and then the project ends there. But we are trying to ensure that we go beyond the 5 years and make sure that young people within the region still have access to these services. And some of them are the structures that we are putting in place, like the youth centers. We are building them, like renovation of the toilet facilities, incinerators, and all these. These are facilities that will live beyond the project. And so for us, there are clear plans that we would use in ensuring that we get the project sustained within the project districts.
So you've mentioned the work you are doing with the people, the close contact with the employees, the stakeholders, Ghana Education Service, Ghana Health Service, and the other NGOs you are partnering with. What are you doing when it comes to policy change? What are you putting in place to make sure that these issues you are raising concern, let's just mention the menstrual hygiene issues. What are you putting in place so that documentations can be made to make sure that the change is very effective?
Good. So like I've said earlier, one of the key things we want to look at is the policy issues on the project. as a country, what policy do we have to drive issues of sexual reproductive health right? And so, as it stands now, we know that SRHR, or sexual reproductive health policy, is dotted around. You have some in family planning policy, you have some in the RAM-CAM policy, and all over the places. How do we get a consolidated policy that drives issues of sexual reproductive health issues? So that is also one of the key things that we are looking at. So as a country, do we have the right policy? Do we have the right frameworks to drive these policies? And we would want to engage our district assemblies, want to engage Ghana Health Service, we are engaging Ghana Education Service to make sure that we streamline all these policy issues so that young people can have access to these services that are being provided within our healthcare.
Okay, so you mentioned FHI, and you said they're the technical advisors for RTP and FAWE. Do they do the same?
Okay, so thank you very much. We have sectioned the project, and so WaterAid has it what we are doing. So as I mentioned earlier, we are focusing on the wash aspect, making sure that our healthcare facilities are wash friendly, and then we're also looking at issue of menstrual health and hygiene. We're also making sure that we engage with religious leaders and duty bearers, and making sure we are dealing with issues of gender equality, issues of negative traditional practices. But Right to Play has its own role to play. They are looking at the in-school section of the project. So building capacity of teachers, building capacity of mentors in schools, building capacity of school children, and all that. Then Right to Play, FHI 360, who is the technical advisor, is looking at mentorship training models that they are developing for them, and then other things that they are doing. You would see FAWE also focusing more on advocacy. So FAWE is also engaging community people, using radio centers and other media platforms to make sure that they do effective engagement so that we sink the information down. Remember I said one of the pillars is to ensure that we have the right information. So that is what they are doing to make sure that the information goes down to the people so that they can have that information that they need to take the right decisions that they are supposed to take.
Yeah. So it's really true that indeed it takes a village
exactly
to raise a child. And I think with WaterAid, FAWE, Right to Play, and FHI, your child here is making sure that SHARE is implemented well.
Exactly.
That is why you're all working together as a group. And we'll just take a final word on how you'd envision the SHARE project impacting the communities that you work in, the adolescents, especially the adolescents and the young people. How do you envision the SHARE project?
Great. So like I've mentioned some of them, so I will re-echo some of them. I mean, first of all, I would be very happy to see communities within our project district where teenage pregnancy is no more. How happy will I be when I see that young person who will become pregnant tomorrow, not getting pregnant, and growing to become that minister we want, growing to become that president we want, growing to become that for the pastor we want, growing to become the teacher we want, growing to become that person in society who can contribute meaningfully to society. And then again, we're also looking at, yes, we are living as human beings, we have our own culture. But how, at the end of the day, are we removing these cultural issues that will affect these young people? And so for me, the whole thing is that by the time we finish the project, we want to see a culture that does not infringe on the right of anybody.
That equality.
That equality that gives access to these young people to also enjoy the same health benefits that the adults, our mothers, our fathers are also enjoying within our healthcare facilities. Again, we are also envisioning that by the time we finish, the health worker, the very health worker who is supposed to provide the counseling, who is supposed to deliver the quality services, have that skill, have that capacity to be able to welcome adolescent girl into the health center and provide the needed service, provide the needed counseling, so that the young person going into the facility will feel loved, will feel comfortable, assertive to walk into a health facility and say, I have come for counseling, so that health worker would be able to provide that service to that person. And lastly, I also want to see an environment where we are managing waste well, we are preventing infections, and I don't go to a hospital and get infected, and the health worker who is working on me also is not infected. I want to see that environment. And so by the end of the project, these are some of the things we envision. We want to see where waste is managed very well. We are segregating waste. I know maybe in one of the episodes we'll talk more about that. We're segregating waste management very, very well. And we have facilities that young people can change themselves during menstruation when they come to our healthcare facilities. I mean, as it stands now, you get to a healthcare facility, a young person menstruates, is going there, he wants to change, and there's no place for you to change. They feel uncomfortable. And so that is what we want to see at the end of the day. And that's where we are working hard towards, that at the end of the day, we would have these youth-friendly centers. We would have what we call the wash-friendly facilities, where access to water, access to quality proper sanitation, and then menstrual health and hygiene facilities and everything is intact, and the young person is going in for that.
Wow, SHARE has a lot in store and is doing a lot. And I can see that with the passion in which you are talking about the project, you have it at heart, and you are doing everything possible with the other consortium partners to make sure that the project achieves its goal and aims.
Exactly.
And you mentioned that the project is also set on building policies that would help change a lot of things that are currently ongoing. And I feel like the changing room should be incorporated in almost every facility.
Exactly. I mean, what we want to do should be a standard for the country, so that we have a model healthcare facility that government can come, look at it, and replicate it across the country. And that's the global standards. That's the WHO standards. That is what we have in our policy document. Those are the standards. But sometimes because of inadequate resources, we are not able to do that. But the government of Canada is helping us, so that at the end of the day, we have that model healthcare facility that as a country, we can come and learn from. But like I said, we can't do this alone. And so we need other partners also on board. We need other NGOs, we need other civil society on board to come and help us, so that together we can do this together.
You need the adolescents and the young people to also help you, so that this project can be successful.
For them, they are the integral part of the project, and they are driving the project.
I feel like they should be very happy and proud, because there's a project that is out here fighting for them. That's all for today. Thank you very much, Gilbert. Thank you for your time.
Thank you.
If you're an adolescent out there and you need any information on your sexual reproductive health, do not hesitate to contact She Plus hotline on 0800 001 122 or any of the numbers on your screen. Thank you. What have you learned from today's episode? Let's hear from you in the comment section. It's a wrap. Thanks for joining us as we kick off this important discussion related to sexual and reproductive health and rights. It's been Let's Share and Molly. See you next time. In the next episode, we'll be discussing gender equality and how it impacts sexual reproductive health and rights. Thank you. Bye.